Hi guys, welcome back to my series of live for Nutrition Week. Today we have a very much in demand topic, skincare, and I hope you've already participated in today's Skin Glow Challenge, and one lucky winner would win a gift hamper from Perenne. So if not, you still have till 8 p.m. to participate today. And today for my live, I have someone very special and a very dear friend of mine, Gitika, Dr. Gitika Gupta. She is a very renowned, celebrated dermatologist. I think she's here. Hi, Gitika.
Hi, Lovneet. How are you?
I'm good. How are you?
All good, all good. Super excited for
Thank
the
you.
live again
Thank
today.
you for joining us today. I know it's been a very busy day for you,
Yeah, a
but
little busy.
Nutrition Week would have been incomplete without you.
Thank you. And I cannot say no to you. And it is such an interesting platform to share more and more information. So why not?
Absolutely. I think when it comes to our skin, we always talk about this that skin is the mirror of our health, what's going on inside the body, right?
Absolutely.
So, and of course, food is the foundation and where you build in. So, skincare and food definitely it's something that many people are interested to know more and more about, and it's very helpful as well. And we have gotten so many questions for you today. Given especially, we are all under a lockdown still, and it's monsoon. So monsoon is a season where many people face skin and hair related issues. So starting with monsoon, Gitika, I would
Yeah.
like to ask you that during this time, hair fall is such a common problem many people face. So
Mm-hmm.
how can we prepare ourselves pre-monsoon, during the season to sort of fight hair fall?
See, hair fall is, of course, like in my clinic OPD also, like I would say 8 out of 10 patients are coming with the problem of hair fall. So, first of all, if I would see a patient and you would agree to it more than anything, running a blood check is really important because there can be so many factors that can lead to hair fall, be it your low hemoglobin or your iron level. So, there's a separate blood check called iron ferritin level that also needs to be done. And then thyroid, vitamin D3, B12, and we also sometimes ask our patients to get their alpha DHT checked in case we also suspect hormonal hair loss. So these are the blood checks that are very important. And once we understand if you are deficient in something which needs to be corrected through your diet or supplements, we start with the other issues, be it your hair serum. So your doctor would suggest you certain hair serums to apply. They can be minoxidil based or non-minoxidil based. That's the call that the doctor takes after assessing your hair fall. And then we suggest you certain conditioners, some shampoos, which have growth factors, which are very important, and some supplements that we give. They are more specific to hair. So they will have combination of biotin, they would have combination of minerals, micro minerals, which are all important to improve the blood circulation for your hair follicle and to have strong hair. But apart from this, sometimes, generally I've seen patients to come to us a little late and the damage has been done quite a lot. So we also suggest them my favorite treatment for the hair, which is called hair PRP. It works beautifully. It's like fertilizer for new hair growth. That's how I explain to all my patients that this is a wondrous treatment. It's golden plasma made from your blood, which is micro injected into the scalp. And not only it can stop active hair fall, but it can also help new hair to grow. So I would suggest that anyone and everyone who is having hair fall should not hesitate or not let the issue be. Get your blood check done. And if it is way too much and you're having, frontal waddling happening or hair thinning, go for a treatment like hair PRP. It would really, really benefit you.
I think that's very helpful. How many sittings do you need usually for this treatment? Is it?
Yeah, so this treatment is done once in a month for 4 months. And like how it is done, it's quite interesting. So when you walk into the clinic, we take about 5 to 10 ml blood sample from you, and then we centrifuge it inside our clinic. So we have a lab in our clinic at ISAC. We centrifuge it, remove the plasma. So when you centrifuge it, the RBC settle down, and then the yellow part is up, which is the golden plasma, which is full of the growth factors. So we separate that out, and then we numb your scalp with the anesthesia lotion so that you don't feel much pain, and we micro inject it. A lot of my patients, in fact, don't have the patience to even numb their scalp because that numbing cream has to be left on for 40 minutes. So they even take this treatment without numbing their scalp. So pain is very personal. Some people feel more pain, some people don't feel any pain. But yeah, I would suggest you can put on the numbing cream, and once the treatment is done, you're good to go. There is no downtime. You can resume your activities. Nothing to be scared about, no side effects. There are only benefits from this treatment.
Yeah, somebody is asking if it is painful, but like just Gitika just said that it's something
Yeah,
many people can go for without even getting the.
absolutely. But it is personal. I would suggest you can put on the numbing cream. There is no harm putting the numbing cream also. But yeah, you would feel definitely a little bit of pressure because your scalp can be sensitive some days. But then the treatment is fairly quick. The entire treatment time is for about an hour and a half to 2 hours. So nothing to really, think or plan ahead.
Right. And we have many questions here about different tablets like Hair Bless or different serums and solutions. And I feel when it comes to your hair and skin, many people self-prescribe these. And as a
Yeah.
nutritionist, I feel even, many of my patients or clients would say that I'm taking this supplement. And if I ask them that was it prescribed, and usually the answer is no. So I would suggest that don't self-prescribe supplements or serums to
Absolutely.
yourself.
Absolutely.
Like Gitika said, that you have to first understand what is the reason behind the hair fall. Sometimes hormonal balance is one of the very major reasons.
Time
Then due
issues.
to increase in humidity, you feel that it has increased, but the key cause could be something else.
The
So
key cause actually, Lavneet, goes back 3 months before the hair fall. 3 months back, that girl would tell me that, oh, I got some hair bonding or strengthening done. Or she would tell me, oh, 3 months back, I went on a crash diet. So
yeah.
certain times you have to self-assess and understand that what actually triggered the hair fall.
Right, and absolutely, especially with many extreme diets where you're only eating fat or you're deleting food groups. Although you might think that you're on high protein, but say for hair, it's not just protein, it's the antioxidants, it's the iron, it's the vitamin D, so many nutrients that go into it that you must get the right assessment done through an expert and then take your treatment forward so that you don't lose out
Absolutely.
time.
So why don't you share maybe a quick recipe which is full of all the good nutrients for hair, because hair is one of the major issues for everyone.
Absolutely. So, just the key nutrients that we do require, of course, protein has to be there, zinc, biotin, vitamin A, E, C, vitamin D. I think, except for vitamin D, that is very rare in food, it's not easy to get it through food. Rest everything else you can find in a very simple smoothie, so to say, you can make. So, you can take almonds, 15 to 20 soaked almonds, add 1 tablespoon of roasted pumpkin seeds in it, 1 tablespoon of roasted wheat germ powder in it, 5 soaked cashews, 1 soaked date, and fig. And
Mm,
for biotin, you can use papaya. That's a very good source of natural
wonderful.
biotin, and it gives a really good flavor as well. So
Mhm.
use this smoothie. I think nutritionally, most of the nutrients are covered. But like Gitika said, it goes 3 months back. So you have to first really do understand your problem and then rely on any serum or one quick smoothie. But this really helps for
Absolutely.
just revitalizing the nutrient intake for your hair growth.
Yeah, yeah. It's almost dinner time and I'm hungry listening to the recipe. It sounds really tempting. But yeah, so if one can look at your diet, those crash diets really do a lot of harm to your hair.
Especially to
And
your
all,
hair, yes.
yeah. And also to the question where, someone was asking me about pain. So we have recently launched a painless PRP at ISAC. So for all of you who are a little hesitant to try this treatment because of the pain, you must try it. It's an exclusive new launch. And the way the procedure of this treatment is very different from the regular PRPs, and it is quite painless.
Thank you, Gitika. Someone is asking how to cure dandruff.
See, dandruff
DIY.
is a fungal infection. There are no DIYs. I would not tell you to put curd in your hair, although it does help sometimes. But that dandruff is sticking to the hair follicle, the roots. It is inhibiting all the oxygenation and blood circulation to the roots, and that is causing your hair fall also. So you have to treat dandruff like a disease. It is a fungal infection. You must use a dandruff anti-dandruff shampoo which has zinc pyrithione or ketoconazole. That is a must. Some shampoos, I would be happy to name them. There's Bioderma DS shampoo, easily available. It's also very mild, doesn't make your hair dry. Then there is Blue Cap shampoo, very easily available again. So make sure you use an anti-dandruff shampoo if you have dandruff. Otherwise, it can also come on your face and cause that redness around your nose and
Yeah.
corners, which is seborrheic dermatitis, and it can give you hair fall. So treat it properly.
Also, like you said, it's a fungal infection. A diet, if your diet is rich in refined carbohydrates and sugar substitutes, that is one
Mhm.
thing that is not going to help your dandruff. So make sure you're fixing these things in your diet as well.
Yes.
Can you give us some tips for rosacea skin?
So rosacea, of course, it is very dietary related also. I'm sure Lovneet would also throw some light on that. So there are certain trigger points to rosacea. What is rosacea? That red, patchy, inflamed skin that you get, and it generally gets triggered with hot weather, with hot showers, with spicy food, with red wine. So again, my general idea when I meet my patients is that I always ask them that look at the trigger. Let's understand what is causing it, because if you can remove the trigger, it's always a better thing. But if you have rosacea, then I would suggest you to remove the trigger. And then there are certain creams like Avene Anti-Rougeous Cream, Bioderma Sensibio Moisturizer. Then you can start applying. It will definitely help in calming down the rosacea. Then there are treatments like photofacials, which are very good for calming down the rosacea on the skin. So that's something that you should always keep in mind. So, Lovely, what do you suggest for people who have rosacea? Something dietary wise?
Like you rightly said, you have to first totally remove the trigger. The trigger has to be removed because that's what first calms down the rosacea. A very alkaline start to the day. So white pumpkin, celery, mint, these three ingredients are very, very alkaline and they definitely help in bringing any inflammation down further. But
Mm-hmm.
please do understand through elimination diets, for some people it could be red wine, it could be mushrooms, it could be bread. So just you must know and identify your trigger through an elimination diet. And the start of the day, I feel, is so important. If you're starting your day with an acidic ash, that might aggravate it given your trigger.
Yeah. Because I see so many women, especially during the lockdown, they cannot not have their red glass of red wine. So I tell them you have to remove it. Otherwise, that trigger will keep making your rosacea worse, and that is not the treatment. So we have to work hand in hand with the diet.
Totally. Someone just asked about inositol. So, would you recommend a supplement? I think it's in relation
With
to hair
my
fall, but
See,
I think
I generally suggested in relation to PCOD, if your hair
PCO.
fall is hormonal, it's the PCOD related hair fall, then yes, definitely we suggest myoinositol as a very important supplement and have seen wonderful results even with acne, hormonal acne, with hair fall, if they are hormonally related. So we cannot just blindly suggest you supplements because not one thing suits everyone.
Talking about acne, Gitika, we have been getting many questions from lockdown brides as well, especially the ones who are really looking for that glow and trying to manage acne. So, firstly, let's talk about probably glow for lockdown brides and then we'll move on to acne.
Absolutely. See, glow comes from within, Lovely. There are no shortcuts. So whatever you are eating, your thinking, your workout, your meditation, the calmness inside, all this reflects on the face. But yeah, a dehydrated skin will never have that glow. So you have to be hydrated inside out. So any treatments or skincare regime should definitely look at the hydration. And vitamin C, which is a powerful antioxidant, not only for your diet, but also for your skin, it's important because it will help remove all those fine lines, skin spots, all those things happen. So for all the lockdown brides, it's important to visit your dermatologist if you haven't till now, Visit your dermatologist, get your skin regime in place, and start getting disciplined. This is not the time for you to, shop around and, pick things and combine them with DIYs. They can actually do more harm than good. Do
Yeah.
follow what your doctor is saying. And depending on your skin type, your doctor would suggest you what needs to be done. So suppose if there is a bride who has acne, she would need a different line of treatment, which would involve certain peels or maybe lasers. Vis a bride who has pigmentation, she would need a different thing. But and also if a bride is just having dullness on the skin, maybe she just needs some oxygenation treatments on the face or maybe some glow infusion facial. So it all depends on in what category does the bride come in, and we treat them accordingly.
Yeah. And also for, I think, diet is such an important part because, like you said, the
Absolutely.
glow definitely comes from within. It's to do with your sleep, your exercise, how calm you're feeling. Sometimes I feel you're doing everything right, but if you're not sleeping enough, it just shows, you'll have puffy eyes,
Absolutely.
you'll feel tired, you'll look tired. And also, I think for brides, sometimes they are in that little bit of desperation to look a certain way. You might go on crash diets, and compromising on your nutrient intake wouldn't be the best way to go forward. I think
Yeah.
for eating your vegetables could really help you bring that glow. So make sure you're having different colors on your plates when it comes to seasonal vegetables. And if you're looking for something that really purifies your blood, wheatgrass powder is something you can start your day with. If you can't get fresh wheatgrass powder, sorry, juice, you can have wheatgrass powder, or have karela and pumpkin juice, half and half, and
That
that
sounds
really works
that
very
sounds
well.
really active. Yeah. Karela and pumpkin. Wow.
Yes. Sometimes it's like, for your skin, all these tonics might not be the best tasting shots to have in the morning, but they work,
Yeah,
especially
but you get
for.
a hang of it, so I think it's fine. Like, thanks to you, I've started having wheatgrass in the morning, first thing in the morning, and it is just fine. It's part of my daily ritual regime now. So you have to do few things, and things which come naturally are always better. And even your treatments will show better results. If I get a patient with a very dehydrated skin, with lots of acne, and is not eating well, is having a lot of gluten and dairy in the diet, no matter how much I do, it will never give them that natural glow. So we all have to work as a team together. Your doctor, your nutritionist, you yourself. It's a team that you have to form.
Absolutely. What about dark circles, Kitika? That is something that is more deep rooted, right? And I think for
Yeah.
dark circles, something very quick. What's your take on how to approach treatment for
See,
dark
under
circles?
eye has a lot of things that need to be addressed. It's just not dark circles sometimes because patients generally come and say, "Oh, I have under eye dark circles," but they can be different types. They can be either, purple colored. So you just stretch the under eye and you see that what kind of color is it? Is it bluish purple? Because if it is so, it's vascular pigmentation. If it is brownish, then it is pigmentation related, melanal pigmentation related, or it can also be baggy eyes, which is the fat pad coming down, or it can be fine lines. So there are various kind of under eye issues which are there. For everything, first rule of thumb is to run a blood check and understand that are you deficient in something, or is it genetic for you? Because hypothyroidism is one of the major reasons of under eye dark circles. So after understanding that, then we go to the treatment. So if you have just pigmentation, then we do eye light treatment, which works beautifully. Of course, we give you certain under eye creams to apply. Every under eye cream is specific for what it is using. So if you have puffy eyes, I'll give you some under eye cream with caffeine. If you have dark circles due to melanin production, I would give you something with vitamin C.
Yeah.
If you have lines, then I would give you something with retinol. So everything is different. And similarly, the treatments that I would choose would depend on what issue you have. So if you have pigmentation related under eye issues, then I will give you eye light treatment. If you have puffy eyes or baggy eyes, then I would give you some energy based treatment like therapy, or I would give you the eye type treatment at Isaac, or I would suggest you Exilis together with filler, because if you are, of a certain age and the fat pad here is gone, which is giving you hollow eyes, then we need to fill it up with a filler. Or if you just have dry eyes, then I would suggest you putting hydrating under eye creams, and eyelid treatment would work for you. But if you have crow's feet, which come over here when you smile, then Botox is best suited. So it's like a very big topic wherein we choose what is the cause and we treat the cause related. It's not just one thing that is fitting everyone. But what do you suggest diet-wise, Lamit, for under eye issues, especially which is, nutritionally related?
Yeah. So, like you said, if it is if it is to do with pigmentation, then definitely amla, vitamin C from amla, especially paired with ginger, had empty
Okay.
stomach. So have at least two amla, fresh amlas. Make 30 ml of amla juice, and don't throw away the pulp. You can use that in rotis or just eat it. Like I just eat it and I love the flavor. And mix it in 1 teaspoon of ginger juice. That helps with pigmentation. I think with the baggy eyes, for which the green tea bags or caffeine really works well. What also works in intake is coriander seed water, and making sure that your dinners are not very high on salt, or especially I've seen for many people, then if they're having eat out, especially of with high in gravies or sauces, then they will definitely see puffy eyes next morning. So start your day with 500 ml of coriander seeds water, where you are infusing 2 teaspoons of coriander seeds, straining it, and just having the water in the morning. That helps. Also, having good fat in your diet is very important. If you don't need to take omega-3 supplements, you could do it if you eat eggs, you could have whole eggs, flax seeds, chia seeds. Know which nuts and seeds work well for you. Coconut, avocado, that really helps with better. The healthy fats really help in bettering the texture overall, the smoothness, and helps with the under eye as well.
Very well. So, in fact, very interesting. So, why would you say to include ginger with amla? What's the reason over there?
It helps in relaxing. So for people who have the muscles are not relaxed, ginger really helps as a natural relaxant. And ginger shot is something that is a natural de-stressor, especially during monsoon. People who get aches and pains, who don't sleep well at night, ginger acts as a natural remedy for all that cluster of symptoms. So that's why it works very well.
Wow,
And I
interesting. So,
think
did we
sleep
have
is,
in the morning or evening? What do you suggest?
if you're pairing it with amla, then you can have it in the morning. But you can, with ginger, you can also make a tea. You can just boil ginger with the water, take an inch, and if you're making it as tea, then you add black pepper. It's a very good tea for your immunity, for sore throat, and it's a natural energizer. It just energizes you. For people who are addicted to caffeine, and that could be another reason, overdoing caffeine shows on your skin. You look always
I'm I'm
too
I'm
tired.
listening. I know that you're trying to tell me to give my coffee.
No, I think you're doing really well in that department, Ritika. You don't need
Thank you. Yeah, so I was
but I
very
think it
clear.
just having that ginger tea with lemon just totally relaxes you, and that reflects on your skin.
Wonderful, wonderful. Good to know. Something I learned today.
Many people are asking about supplements. So, what's your take on collagen? Do you who needs it? I think this is one of the most frequently asked question.
So it's a
Do I
very
need it?
tricky,
Should I?
yes.
Yes,
So
yes.
it's a very tricky thing. So let me answer the first thing first. Do you need it? So you need vitamin C for collagen first of all, because vitamin C is an important trigger for collagen remodeling. So vitamin C is more important than collagen. So if you are thinking whether I should have collagen or not, first you should be consuming loads of vitamin C. And vitamin C is a water soluble vitamin. So even if you're having loads of it, it will get drained out of your body no matter how much you have. But minimum 1,000 international units every day is something you should be taking in. And collagen is good. It's good for your skin, it's good for your hair, for your nails, for your joints, everything. Going back scientifically, there's little evidence that it has shown when it comes to your skin. Although there are certain scientific papers which say that the wrinkle appearance was lesser with intake of collagen. but definitely it's very good for your joint health also. So if you're planning to take collagen, make sure you stick to it for a long time. You cannot just take it for a month and forget about it. You should be taking for at least few months together to see some good result. There are some really good collagen available in the market. There is GNC Neo Collagen, there is Kilixer Collagen, there is Liftash Collagen, there is Amino Collagen, there is Nova something. So there are loads of collagen available. But the point being here, vitamin C is really important. And second of all, you should be regular with it. Like I met someone the other day, there was this patient, and she said, no, my doctor said just have collagen once in a week. I don't understand that how will that work? It will not give you any results. So if you're planning to take it, you should be taking it regularly.
Yeah.
What do you think
And also,
diet-wise, Lovneet? I understand the dietary sources for collagen are limited, but if you can, share some
but
knowledge on
I
that.
feel our body is, I mean, it naturally has collagen in it, right? And it's not just for your skin, but for your joint, for your gut health, for your muscles, there's so many areas where collagen is needed. But you should understand that, is your collagen really depleted? Do you need it? Like, at what, if you're late 20s and you're taking collagen supplements, I don't know how productive is that going to be. Of course, a good mix of essential amino acids, branched chain amino acids in your diet, and like you rightly said, even in our body, we need enough vitamin C for making that collagen. So if you
Yes.
are having a diet that is rich in complete protein, I think sometimes when you are vegetarian, and Indians any which ways, we are at risk for protein deficiency, then you might see the change right away, because you start having these good quality proteins through collagen supplement and you see that your skin is changing. But that would also be true if you start having a better combination of proteins in your diet. So proteins through your lentils, whole grains, paneer. If you're eating eggs, egg is a complete protein. Now, of course, marine collagen is different. Your collagen 1 and 3, that is totally different. But I think if you are young and you don't have any other issues around, your joints, and you don't need it, you can easily manage to, have good mix of amino acids through your diet and vitamin C to make it in your body.
Very
And
well.
say somebody is asking for glutathione, that do you need that supplement, especially for
You're
a
asking me
hypertensive?
all the controversial things in the chat, huh? So yeah, glutathione is a very powerful antioxidant and it is nothing artificial. Even Lavneet would talk about certain natural glutathione producing foods. There are foods which are rich in glutathione, in fact. But the point is that after a certain age, say after 20, the production of glutathione starts to deplete in the body. And glutathione not only protects your skin from getting pigmented, but it also is liver protective. It also protects a lot of your organ functions. So glutathione is in fact really, really an important antioxidant. But generally, we have come to know about glutathione as a skin glow antioxidant because it brightens up your skin tone. So yes, glutathione is great. It also helps energize your body. It's also very good for thyroid patients because it is very important in their pathway. So we generally suggest medically to take about 1,000 international units per day, but you need to have a good source of glutathione together with vitamin C, which increases its absorption. So all these things are important. In fact, in my clinic, we also have glutathione IV drips, which are 100% absorption capability. So if you take oral glutathione, it only gets 30% absorbed. Vis-a-vis when you take an IV drip, it gets 100% absorbed. So these IV drips are particularly very, very popular amongst the brides because that is the time they just don't want their face to be shining bright, but also their body. And so that's for glutathione. Definitely, they're very safe. You should take a full course for 3 months if you're planning to take oral glutathione to see any good result. So, Lavneet, what about some glutathione-rich foods? There are a lot of foods out there which have glutathione, natural glutathione.
I feel, even just like we talked about collagen, I think we get stuck in these nutrient names. Say, for example, collagen or glutathione and my vitamin C and my retinol. But even for glutathione, I would say that if you're having a good twice in a day, you're having a good serving of nuts and seeds. But again, you have to see what source is working for you or not. Because in skin, what I have seen is, say something as simple as flax seeds can work for somebody and give itchiness to someone else or acne to someone else. So make sure that you know your food sources in a way that is working well for your skin, and do you really need it, right?
Absolutely.
I think
We can
that's
all
where the
use a
balance.
little glow, Lovneet.
I know. Someone is asking how to cure psoriasis from face.
So you need to visit your dermatologist and understand it's an autoimmune disorder. So we would need to see that is there in a remission phase or are you in active phase, how bad it is, where all it is on your body, and then you need to get proper treatment done for the same.
Especially for something like psoriasis, because if you don't know exactly if your blood work is not done and if you're not doing the right treatment, then it could really aggravate.
Absolutely, absolutely.
Gitika, what about your skincare routine? I'm actually very inquisitive to know what's your skincare routine.
So my skincare routine is pretty exhaustive for anyone and everyone over here. There are no shortcuts. Of course, I'm really blessed with good genes when it comes to skin. Genetics play a very important role. But then I'm one of those who have a very good relationship with the skin. I understand my diet, which is important. I understand my water intake. I understand my workout, my meditation, my sleep. I don't try to compromise on any of these things. And then comes my skincare regime, which is morning routine and the evening routine. So I never sleep with my makeup on. I follow everything that I preach, be it your face wash, to your toner, essence, under eye cream, moisturizer, followed by the sunblock. I always follow that. And at night, it's always similar. I use retinol maybe twice in a week, and I exfoliate my skin maybe once or twice in a week. And I do take my laser treatments once or twice in a month whenever my skin feels the need for it. And I do a lot of infusion treatments on my skin. So I don't like to do a lot of resurfacing because my skin doesn't need it. But I do a lot of glow infusions where we infuse vitamins inside the skin so that the skin shows the glow from inside. So, and I love sheet masking. I'm sure for people who know me or follow my live already, they know how much I love sheet masking because that is direct hydration on the face. So it's always, an assimilation of all the things together, which will always reflect on the skin.
Absolutely, absolutely. I think it is a continuous. It's day to day. What you do is then shows on your skin. It is not something that you could change
Yes,
overnight. And
yes, absolutely.
just like weight, I think skin is something many people would want. Ki, I need something. I need a makeover. Do something. Can I? It's never something. It's never a miracle, right? You have to work on it. It takes time. It
Absolutely.
takes attention, and it takes an expert.
See, there are a
Right.
lot of compliments for you. So, Lavneet man's skin is always glowing. So, that's good food. So, whatever you're eating, it's always going to reflect on your skin. So, they are definitely, that
Yes.
works.
My actually for skincare, my everyone who knows me and who sees me for hours in a day, my staff and people I work with, they laugh about how much water I drink. I think it's to do with also how much I have to talk, but I just cannot live without water. Like hydration is important. I can never let go of my sleep. I'm a very early sleeper. I wake up early, and there are certain things I will never compromise on, no matter what. Like my meals, my meal timings, time with the family. I think it all reflects, not just
Yes. If you're a
Uh,
happier person, your happier body, your happier body cells, it will always reflect on the face.
Absolutely, absolutely. And especially, I feel these days, we're all under a lockdown and we are trying to take care of ourselves. And my advice to most men and women, actually, Gitika, today we've gotten many questions from men as well. I think I should get to that too. That simple skincare grooming routines for men who are trying to take care of their skin. Especially, I think we had question about excessive sweating and rashes on the face.
Okay. See, first of all, skincare regime for men, it has to be cleansing and then moisturizing and then the sunblock in the morning. And then at night, I would definitely want them to use a face wash again. Men generally hesitate from washing their face, being lazy, but you need to wash your face, exfoliate your face, use a moisturizer. You can use certain target oriented, nutrients at night. If you have pigmentation or wrinkles that you want to target, you can use that and followed by a night cream. That's all. I think that's a good thing. And if you can go in for a medifacial once in a month, it will definitely enhance and take care of your skin even more.
There are questions about inositol. I think we've already talked about that.
Navneet,
Um,
sorry, my battery is quite low. I might just, my phone might just conk off any moment.
but I think we've covered most of it, Gitika. Thank you so much for your time.
Thank
I think
you.
this was very helpful, and it's always good to see you. I hope I get to
Absolutely.
see you
Same here.
soon in
Yes,
person.
yes, absolutely. Thanks for inviting me. And thanks
Thank
for all
you.
the viewers to keep sending us all the questions. Thank
And
you.
if you have any more questions about skin, hair care, feel free to message Gitika, Dr. Gitika Gupta. Thank you,
Absolutely.
Gitika.
Thank you.
Take care.
You too.
So, thank you everyone for joining us today. Stay tuned with our Nutrition Week challenges and lives, daily lives. Tomorrow we have something new, exciting for you. So, keep watching this space to know about tomorrow's activity. We will be announcing our winner very soon. See you tomorrow evening. Bye.